a woman's urethra is shorter than a man's urethra. And then what is the urethra? The urethra is a tube through which urine moves or passes down from the bladder onto the outside part of the body. From the bladder, you pee it out through your vagina or through the penis. Today, we are going to be talking about the urinary tract infection. And the urinary tract infection is just an infection of the urinary system, which includes the bladder, the urethra, and the kidneys. Hello everyone, welcome to my page and you're welcome to Blissful Life. My name is said, we will be talking about the urinary tract infection or the UTI. Women are at a higher risk of having UTI than men because their urethra is very short. Again, because of the anatomy of the female's body, her urethra or a woman's urethra is closer to her anus and her vagina, while the urethral opening is closer to the bladder. So if any infection comes to the woman's body, it is very, very easy for it to travel up onto the bladder and spread between the bladders and climb up to the kidneys. Okay? So we're going to be talking about the causes. What could cause or what could bring about the urinary tract infection? So like I said before, the first thing is sex. All right, so when you have sex with someone that's got any type of infection, like the sexually transmitted disease, like the gonorrhea, the chlamydia, the herpes, etc., because the urethra is closer to the anus and the vagina, it is very easy for the infection to climb up and infect your bladders and your kidneys. So that is why after having sex, you hear some people say after having sex, make sure you urinate, though. Make sure you urinate so that you flush out the infection that is climbing up. So this is one of the reasons. So because a woman's urethra is shorter, she has to be very careful because women are always having recurrent UTIs. Another thing that could cause urinary tract infection is when a disease spread from the anus up into the urethra, because sometimes when you go to after using the toilet, it is advised that a woman should clean or a man should clean from front to back. So after using the toilet, it is advised that you clean from front to back and not from back to front, because when you clean from back to front, you are introducing infections into the vagina. All right, so and then if there is anything that is causing infection to your anus, that disease, that bacteria can break free and climb into your urethra and up, and it spreads to your kidneys, it spreads to your bladder, thereby causing the urinary tract. UTI typically occurs when bacteria enters the urinary system, okay, through the urethra and starts spreading between the bladder and the kidneys. I hope that makes sense. Right? We're going to be talking about the risk factors. What could predispose a woman to having urinary tract infection? Number one, the anatomy of a woman's body, the makeup of a woman's body. So like I said before, a woman's urethra is shorter than a man's urethra. Therefore, a woman is at a very high risk of developing UTI, right? Number two, sexual activities. So like I said, any woman who is sexually active can have UTIs because infections can, bacteria can climb up from the vagina, or when you're practicing anal sex, it can swim up from your vagina or to the or from the anus, and then climb up into the urethra, and up it goes into the bladder, and up it goes again to the kidneys, thereby causing urinary tract infections. Okay, is the menopause. When a woman is in her menopausal stage, in her menopausal age, she can be predisposed to having UTI. Another cause is a suppressed immune system, like when someone has diabetes, when someone has diabetes, she can be predisposed to having UTI very, very often. Then another one is catheter use. Of course, we all know that most times when someone has got catheter in situ, whether a man or a woman, sometimes the person can have urinary tract infection, especially people that's got long-term catheter. Okay, because that tube has been in there for a while. It can start breeding infections. It can start breeding bacteria, rather. It can start breeding bacteria which can break through and travel up to the urethra and then spread between your bladder and the kidneys. So that's it. Yeah. So let's talk about the symptoms. How are you going to know that, oh, I've got UTI, or how do you suspect that you've got UTI that will now make you to start raising concern or go to the doctor? Number one is pain or burning sensation when urinating. Number two is you notice that you urinate more often than usual. Number three is called what we call urgency in urinating. Like, you feel that if you don't urinate now, you're going to wee on your body. So it's called urgency. So there is urgency in urinating as well. Again, when you go to urinate, you feel that your bladder is full, but when you get to the toilet, you just pass tiny or small amounts of urine. And then when you go back again, you still have the urge to urinate. You go back to the toilet and then you pass out tiny or small amount of urine. That is when you know that there may be a problem. Again, another one is cloudy urine. Your urine is supposed to be amber in color, right? But then you see it becoming cloudy, then you know that there is problem. Another sign or another symptom is blood in urine. You would notice that the color of your urine is becoming more darker or more reddish than normal. Then you will know that there is a problem. Another one is strong smell. Your urine would have a very strong, very, very strong smell. That is when you will know that there is problem somewhere. You would have lower abdominal pain as well as pain in the back, just under the ribs, you see. So when you start having such symptoms, that is when you know that there is a problem somewhere and I need to go and see the doctor as soon as possible. Talk about the prevention of this urinary tract infection. Number one is drinking plenty of water, because when you drink plenty of water, you urinate more, and this helps to flush out any bacteria or any toxin in the urinary tract. It helps to wash out, it helps to flush down any bacteria there. Number two is after going to the toilet, after using the toilet, please make sure you clean from front to back and not from back to front, because when you clean from front to back, you are at a lower risk of having urinary tract infection. Again, it is also advisable that after going to the toilet, you use water to wash your private areas instead of using the tissue paper, because when you wash your private areas with water, it tends to make it a little bit more cleaner than when you use the tissue papers. So if you are not a fan of using water, then do it right with the tissue papers. All right, so clean from front to back to avoid introducing bacteria into your urinary tract, to avoid introducing bacteria into your urethra. Number three is empty your bladder immediately after sex. That is, immediately after having sex, please and please make sure you pass urine, make sure you urinate, because this would prevent any bacteria that is climbing up into the urinary tract. It will stop it. So drink water and then you pass urine, as this would help to wash out bacteria from climbing up into your urinary tract, thereby causing infection. And then again, there is this juice called the cranberry juice. I don't know, the cranberry juice is very, very good. They said it helps with controlling UTI in women, that if you're taking cranberry juice, it prevents or it helps to lower your risk of having infections, urinary tract infection. So if you're having this problem, if you're battling with UTI, or if you do not want to have UTI, please go and look for cranberry juice. Okay, so what happens if you do not treat the UTI you've got? In a long run, if you do not treat UTI that you've got, then there will be you have kidney failures. Your kidney will be damaged. You will have problems with your kidneys, and then you have sepsis, and then you would have repeated infections. It will continue to reoccur until you get proper treatment, right? So this is the end of our lectures for today. It is just general knowledge, and if you're happy with this video, kindly like, share, and follow my page as well. Thank you, and I will see you in my next video. Bye.